Thank you for attending tonight's seminar. My name's Kendall. I am the practice manager at Vision Development Center of Lancaster, along with Amanda, who is the head therapist in the vision therapy department. Tonight, we are going to talk about a couple different things. First off, what our practice does here and who runs our practice. That is Dr. Seiderman. The types of things that we work with here at Vision Development Center, such as individuals who have symptoms of ADHD, vision-related issues. We're going to talk about how we can help to correct some of these issues through the use of vision therapy. Also, we're going to talk about common symptoms of vision-related problems. And then at the end, we will go over how to contact us for further information or to set up an appointment, or if you have any further questions. Next. Vision Development Center of Lancaster is owned by Dr. Arthur Seiderman. He is a doctor of optometry who also has his master's degree in child psychology. He has been in the area of Lancaster County for 30 plus years. At one time, he had several office locations in Philly, New Jersey, and down south. At his retirement age, he did decide to sell all the practices and keep the Lancaster County office due to the demand and his fellow clientele. He has lectured all over the United States and even in Canada and Europe about his work that has helped thousands of individuals. Next. So we're going to start with talking about what is ADHD. And ADHD is definitely a complex neurological disorder. There are a lot of things that are affected by that disorder itself. But the symptoms of ADHD, one of the biggest ones that we do see are sensory issues, along with the ability to process information. As the kids are coming in, we are looking for a lot of the same symptoms, and our hope is that we can treat those symptoms for them to be able to make things easier as they move forward. While vision therapy will not get rid of ADHD, it can make the child's life so much easier because we give them skills to cope with the things that are hard for them at school and things like that. Next. So binocular dysfunctions can kind of present in a lot of different symptoms, but most of them are the same as ADHD. Kids who have trouble sitting still, can't concentrate for very long. Those symptoms tend to be because they are having a hard time with what they're doing. So the hope is with that vision therapy, while we cannot cure things like ADHD, we are able to make school easier for those kids, kind of remove one more hurdle. So we allow them to be able to move forward and deal with those things that they have. So that does not mean, though, that every single person who has these symptoms has ADHD. If those symptoms are presented because of a visual dysfunction, those we're able to correct pretty quickly because we don't have other factors to address. We just have the vision to address. So next. So a lot of times you'll see that your kids are really struggling in school and you're wondering at home, like how, they're able to do these things if I ask them if they can do it verbally, but have difficulties like reading, but they can remember when you read to them. Those kinds of things can be indicative of a visual dysfunction. They're avoiding using their visual system in favor of others, like hearing, touch, things like that. So we're looking at kids who are really struggling in school, And one of the main ways that a visual dysfunction can be symptomatic for a kid is that they will actually see double. So they'll see two of everything that they see. Next, this is just an example of what kids who have double vision, it can look like. So when they're struggling to read, they're becoming overwhelmed, and that frustration then shows through on their behavior. Can you go next? So binocular vision, it really allows us to perceive a lot of things in our environment. Um, One of the big ones is spatial awareness. Depth perception is not possible without binocular vision. So if a person is only using input from one eye instead of both, those connections to the brain are lacking, and then they're not able to perceive things like space around them. It's just not something that they're capable. Everything's flat to them. Um, And then when they are lacking in these skills of allowing the brain and eyes to make sense of the world that's around them, they will start relying on other senses. So I have an example. We go to the next of what we're kind of talking about as we talk about the things that our brain fills in, the information that gets finished for us. So if you look at this picture on the screen, it's not very clear what it is. Um, I, I know I tend to see a turtle, and I've heard a couple different answers, but the picture is actually next a cow. But if a cow is not something that you're used to seeing, your brain didn't fill that information in next until now you have the answer and you can go back and see it. These are perception skills that are a direct result of vision. And so if a child or person is struggling with their vision, they are going to have a hard time with those related skills. So when we test people for a visual dysfunction, next, we'll talk about that in a minute. We test people for a visual dysfunction. ADHD is very complex. You have a lot more to go over than just an hour of some questions. ADHD can be really hard to get diagnosed, and it's a process. Fortunately, the visual side of it, we are actually able to test for a visual dysfunction relatively easily. They come in to have the evaluation, and we can see what is going on with a few tests. So that does not, it'll show a visual dysfunction, but it won't tell us if they have ADHD, but it will help to treat some of the symptoms of a person who has ADHD. So one of the tests that we use to check for perceptual is this form fitter board. So if you go to the next, what we do is we take this board apart and we separate all the pieces, and we ask the kids to put it back together, which sounds like it may be a relatively easy task. But if you take a kid who is visually avoidant, they are going to find ways to solve this puzzle without having to rely mostly on their eyes. You will see things like next, they will just kind of put the shape into the hole and press and feel and see if it fits. If not, they'll move to the next one. So they're not using their eyes to take in the world, they're using other skills. We'll see a lot of the kids that are visual avoidant will put things in their mouth. You'll see it more as they get older, as opposed to kids who are not visually avoidant. They're less likely to put things in their mouth. Not impossible, because kids will put things in their mouth, but it's one of the ways that they kind of learn to maneuver the world around them to get around relying on their visual system. One of the other ways that we do this next, we actually have a copy form. And so we give a set of directions and say, okay, I have these 7 shapes and I'm going to show them to you one at a time. And as I show you each form, I would like you to copy it onto your paper. And that's it. That's all the directions they get.
So next, and so if we struggle with space and perception, they're going to struggle with where to start. That's a big one, just as where do we start? We'll see lots of examples of ways to go about this, but they also struggle then to just make shapes. So this first example here shows a couple things. It shows a kid who's really struggling with those diamonds. They can't make those ankles meet. But this also shows another major symptom of a visual dysfunction is that this young man wrote his name mirrored. That is not uncommon with kids with visual dysfunctions because the mirroring of images in our brain is a visual skill. Just like when you look in the mirror, everything seems like it should be one way. And we kind of flip, and it's hard to imagine what that opposite would look like. And that's how they're living their every life. What is supposed to be the opposite? Their brain doesn't do that mirroring to give them that sense of direction. And so you'll see things like words being written backwards. And that can then manifest in reading and writing also, because if they are reading words backwards, you'll see was, they'll say was instead of saw. B's as D's is a major one that most kids struggle with. So you add in a visual dysfunction, and when letters don't always look the same, they're hard to read because they don't always look the same. Next, this perceptual skill is something that gives us a lot of information in a very short amount of time. So this next one, Elizabeth, when she started, she could not make that diamond, as you can see. And we don't make shapes in therapy. It's not something that we necessarily do. And then when she was tested 5 months later, same test, same directions, she was able to complete it much more accurately. But then we're also looking at other things with this, like how the first one, those first couple shapes were really small, and then those harder ones she made bigger to try to make it fit. On that second one, you're seeing more consistency, better spacing. She's not overlapping different shapes. And so that's that spatial awareness and that ability to plan for where things are supposed to go. And that can manifest in a lot of ways at school, but at home too. Kids who are highly disorganized will have spatial awareness difficulties because they just don't have the ability to plan for where things are supposed to go. And so they can have a hard time planning to put them there. Next, another example here shows a different problem on the same test. This young man really struggled with that divided rectangle. And while he was aware that it didn't look like the one it was supposed to look like, he couldn't figure out how to make those triangles all fit together. So he just drew a bunch side by side. And that's an example of trying to get to the right conclusion, but not finding the easiest way to get there. They tend to struggle in finding the path of least resistance. And then the more they struggle, the more behind they get and the more troubles they have. So next. So we have, this is the study of attention therapy on reading comprehension. Who was this, his study?
Yes, this is a study that Dr. Seiderman did with his longtime partner that has since passed away. And that is kind of how vision therapy emerged. Like I said earlier, Dr. Seiderman is a doctor of optometry with a master's degree in child psychology. So this other individual who he worked with, he was a psychiatrist, and they were seeing a lot of issues and they decided to work together to figure out how the two kind of merge. So Dr. Seiderman was seeing a lot of individuals coming into his clinic complaining of blurry vision, um, things jumping around on the paper when they were reading, things disappearing. And then the psychiatrist was also seeing individual school-age children who were complaining that when they would look at reading material for a long time, their eyes would go funny. And so Dr. Seiderman would do the traditional eye exam on them. However, they would have 20/20 vision. So he couldn't prescribe them glasses for these elements that they were saying that they were complaining of, because the glasses wouldn't do anything because they had 20/20 sight. So in theory, this case study, it shows how the visual system, even though it's our eyes, it's more connected with the brain and the ability to process the information that we see. And so when our visual system is not working together as a team with the brain, that is where you get some of these ADHD symptoms because of that. Next.
So connecting those symptoms to a way to actually improve those symptoms. What can we do to help those kids? They're having a lot of these learning related vision problems. And Dr. Sider, they were able to come up with vision therapy. So while vision therapy is not going to go back and cure a neurological disorder, it can really help with those learning deficits, because vision is such a large input into our learning system as our kids live it every day. And so if they're struggling to take visual information, school is going to be even more frustrating than if they didn't have those visual symptoms on top of the others. And so if it is a visual dysfunction, those learning related problems will effectively disappear. Now, if the symptoms, of course, are deeper, like ADHD and things like that, they won't disappear, but they become more manageable and easier for them to make it through and to retain the information and to learn. And then as that confidence increases in their own, ability to do the things that they're being asked to do, the symptoms also are improving because they're more willing to try new things. And vision therapy I've seen it help so many kids just be able to better process information, and things that we tend to take for granted, like knowing what's important and what isn't, is not easy for kids who have these visual problems, because to them they don't really know what's important because none of it makes sense. And so not only do they just try to remember everything so they don't remember anything, you get this sort of cycle where they're really struggling. And once a kid is behind, it's hard for them to catch up, not just because of the learning part, but because of that confidence part. Um, and one of the big things that we really try for here in therapy is to just start easy, start with things that we know they can do, and then build them up and challenge them small steps at a time, to that this is hard, but we're going to find a way to get through it. And that ability to overcome and do better and be able to figure it out and finish has such a huge impact on their confidence. And I know that we can't always solve all of the problems. But I've been here for a few years, and I'm here because I enjoy it and I love helping these kids and allowing them to have an easier time in school. We can't solve all the problems, but we can take one of those hurdles away for them. It's one less thing they have to jump over to get to that end goal. And as I know, as a parent myself, you can't always take away all the hurdles, we can help eliminate as many as possible, they have a better chance of getting to that finish line. And we would really like the opportunity to see if your children are having those symptoms and to see if we're able to help them. Um, Next.
So at this time, if you have any questions, we would like to open the floor up to be able to help answer them. Again, if you have a question but don't feel confident in asking it over the webinar, our phone number is listed at the bottom. We ask that you reach out and contact us. And on the next slide, I'm going to go over if you want to pursue the next step of getting a consultation with Dr. Seiderman, what that looks like. Next. So the easiest way to set up a consultation is by calling our office and then scheduling it with myself. And I just go over some basic information, just kind of pre-screening, making sure that you're calling for the right reason, because as we do, like I said before, deal with the eyes, a lot of individuals get confused as to what's the difference between your screening and the traditional eye test screening. And so we walk through that over the phone again to make sure that you're not looking for a prescription for glasses or contacts, that you're also looking for a binocular vision screening. If you mention the webinar that you attended, the consultation will be comped for you at a free price. The other way, if you still want to do some investigation, we have a very helpful website, and our website is listed on number 2. I would advise you to go through that website. There's some very good testimonials on there from parents that we have worked with, and just how it's changed not only the kids' lives, the parents' lives, and the family lives. A family is a unit. So when you have one faulty thing in the unit, it can really disrupt the whole family. So by helping to help everybody in the family realize what's going